addressing the resident with a weak side. So I'm gonna go ahead and wash hands, knock knock. Good morning, my name's Xavier, I'll be your CNA for today. Is it okay if I check your name, ma'am? Mrs. Meredith Gray, nice to meet you. I'll be calling you Mrs. Gray. Make sure you check both sides. Sometimes they might have a weak side. In this particular case, there is a weak side, and it's on the left side because the patient has a hand roll. So that signifies the weak side. So I'll be right back. What color gown would you like, a red one or a blue one? So would you like a blue one? Okay, so I'll be back with the blue gown. I'll wash my hands. I'll grab the supplies. So make sure you give the patient an option. That's part of their independence. It's part of their choice. So we're gonna make sure to always remember the acronym TOSS, POW. So TOSS is take off strong side, POW is put on weak. So we need to remove the old gown, so TOSS, take off strong side, which I'll start from the right side because this is their stronger side. So I'll make sure that the bed is up. I'll make sure to lower the side rail. And I'm gonna ask if you can please raise your head for me. We're gonna start with the strong side. So they're gonna remove this one. Try to keep them covered as much as possible. And then we're gonna raise the side rail. And I'll go to the other side. So I'm going to go ahead and remove the other side of the gown. And as you're removing it, you can also mention that you're going to wear gloves just in case if there's any blood or anything soiled in the gown. Again, make sure the patient's covered. I'll remove any gloves that I'm using and wash my hands. And here's the blue gown that you requested. I'm going to put this over the top, the bath blanket. So put it on top, and we're gonna go ahead and put on the gown on the weak side. So POW, put on weak side. This is the weak side. We'll start here first. And then we're gonna put on the other side of the gown. Can you raise your head for me? So you can go ahead and tie the strings. You only have to tie the top part. And we're gonna lower the bath blanket. Also, we can make sure to add the non-skid socks so they don't slip. So we'll just kind of put the socks on. And for safety, raise the side rail and lower the bed. So Mrs. Gray, everything going okay? Okay. So I'm gonna go ahead and just clean up the supplies and I'll be right back. So this goes to their personal belongings and this goes in the trash. So I'll wash my hands. Here is your call light, your phone, tissue, water, and magazines. If there's anything else you need, just let me know and I'll be right back. So I'll open the curtains, I'll wash my hands, step outside, record, and report.